were speaking today at an event. What event was that?
I am at the event because we are concerned with the health care of everyone, so we came here to talk about, to support the option that the President has given us for health care for everyone.
What specifically about that option is most important to you? How do you understand that option to work? And tell me a little bit about it. What is your...
Well, I understand because as a person who has been in the health field for over 30 years, I was a director for Health and Hospital Corporation, and I saw people who came into the emergency room without insurance, and I saw how those that was covered under private insurance had to sit in the emergency room and wait for approval. Those who didn't have the insurance had to wait, and most of them sit there and got sicker in the emergency room. And I know for a fact that if they come in with the coverage and knowing that the government is all going to support that everybody all has insurance, they will be seen that there is no respect of those who have and have not.
So in your experience in the emergency room, you saw people that were turned away from the emergency room without treatment?
They were treated as what we call treated. They were triaged and then sent to see their private health care representative, the doctor. But some of them did not receive the treatment that they needed. Some of them need to be admitted right on the spot, but because it was not approved by the managed care insurance, they were turned away.
So one of the criticisms, I guess, that comes from some of the other sides of the argument for a public option that revolve around cost. We want to try to get some people's perceptions of what that cost should be, and specifically where the money for that should come from.
Yeah, but look at it this way. Who do you think paid for Medicaid? The people, it come from the taxpayer. So their position is not valid. They're paying right now. Only the payment that they're making now is not of the people's choice, that the people can choose insurance. Like small business cannot get Medicaid. But under this plan, people with small business who do not have insurance can get insurance. They are insured. So what I see there, I don't support the fact that they are going to be paying because they are taxpayers. Small business people are taxpayers too. We too are taxpayers, and we pay taxes. Only the people on Medicaid that are diligent, those who do not have any coverage, fall under Medicaid, and taxpayer covers that.
So what do you think the cost per person would be for such a plan? Any ideas? What would you...
No, I have not looked into that because for myself, I'm in preventive medicine, and I go about the country telling people how to keep away from getting sick. I tell them the plan to do preventive medicine. This way, they would not have to end up in the emergency room and getting sick and having to go to see a doctor. So I have not looked at the cost effective, but I will take a look at it so that I can have that to talk to people about at the same time and let them know that the cost, what it would cost them, and let them have a clear picture of what it costs to go to the emergency room and be treated and what it would cost for prevention. And then they will have something to weigh as to when they have, need to go to the emergency room or when they become sick.
Okay. Well, you mentioned that you were doing preventive health and so forth, and one of the proposals that's seeing some, I guess, traction on Capitol Hill is the idea of differential charges for coverages based on people's lifestyle issues. So in other words, if you're a smoker, you may pay more. If you are obese, you may pay more. What do you think about those ideas?
I don't think that people, like I said, insurance should not be according to what a person's lifestyle or what they should do. Insurance coverage should be for all, and it should be of no respect to person. If the person has pre-existing disease, I think they should be treated because the person probably did not get treated in the beginning is because they had no insurance. So they let it prolong until it got to the point where they had to go see a doctor. So those people, I think they should not be charged more. I think they should be charged the same across the board.
Regardless of their choices lifestyle-wise.
Regardless of their choice.
Some of the things that are being discussed as far as options for ways to generate the revenue to provide coverage for everyone. One of the options is taxing the employer-paid benefits that are currently in existence. How do you feel about that option? What do you think the impact would be? You said you're a small business owner. Is that something you would support?
I don't feel that should be the employer should be taxed more, because I think we already pay enough into the government for that to support it. Because once this health care take the place of Medicaid, they're going to find that they have enough money to cover it. Because I think the health care that we have right now, the Medicaid that is supporting the people, I feel that once that is moved and this insurance that the president have come up with across the board will take care of it.
So you think it can be done without any additional taxes?
I feel that it can be. I feel that it really can be done without additional taxes.